This is part C of Addiction Seminar 3 about training for parents and friends of loved ones with addiction. And this section looks at behavioural management strategies and overall approach to treatments. This fourth area of working with loved ones with substance use is about behaviour management, which is all about improving behaviour by encouraging desirable behaviour and discouraging undesirable behaviour. Behaviour management reminds you of using star charts with children. This section will be looking at the understanding of basic psychological reactions by learning the ABC, which is an acronym for activation, behavioural beliefs and consequences. Now, even with adult brains, we all do things that are pleasant and tend to avoid things that are unpleasant, but the more drug affected we are, the smart brain has less effect in inhibiting the animal brain, and the more people tend to function at this basic animal brain or primitive brain level. When you're working with your loved one, it requires a lot of planning and patience and persistence, but with this, it will have a powerful effect. I find it's most family and friends find it difficult to just persist with this because it takes a lot of planning and preparation, but it's well worth it. The other objection can be that they say it's like treating an adult like a child, and I've found that with explanation this can be overcome because it can be explained that it is a treatment and it doesn't apply to all of your relationship with your loved one, but only to a part of their behaviour, and so it can be quite well accepted. So we'll go on to look at the basics of ABC. So this is a diagram of how behaviours are learned or unlearned at a primitive brain level or animal brain level. So following some sort of activator, a behaviour occurs with a consequence which either reinforces or discourages that behaviour from happening again. Behaviours may also be associated with a belief, or it may simply be an automatically learned response to a given activator. An activator may be external or internal. An external activator might be, for example, people, places, or times. An internal activator might be a feeling like loneliness, anxiety, or a spontaneous urge. Behaviours are a response to that activator, and for example, in response to an urge, a person might visit a dealer, a behaviour that doesn't require any thought at all. Or the person might have a thought associated with that, such as, I can't cope with urges, and that leads to then visiting the dealer. The consequences are as a result of that behaviour. For example, using drugs leads to a feel-good initially, and then possibly a few days later feeling bad during the withdrawal, or as a result of the consequences such as running out of money. So why do people continue with behaviours that often lead to delayed outcomes? And one could think about this in terms of how animal brains work. When one is training an animal, they respond to immediate rewards, but a delayed reward or a delayed punishment would have no effect on their behaviour. And in the sense that the person is operating with a not very functional smart brain, this is often how the drugs cause such reinforcement, is that the initial high reinforces the behaviour, but the downside doesn't get linked to that behaviour by the brain. Consequences are a major tool for modifying behaviour, and it's important to understand the 4 types of outcomes. 2 are reinforcing and 2 are discouraging. The 2 reinforcing are reward, which is adding something positive, such as a verbal compliment, and the other reinforcing one is relief, which is removing something negative, such as cancelling a debt. 2 discouraging ones are penalty, which is the loss of something positive, such as the loss of a privilege, and then the other discouraging one is punishment, or the addition of something negative, which we tend to discourage people from using, and it's better to let nature take its course in allowing natural consequences to form punishments. We do this by making sure that we keep our limits set firm, and that people then wear the results of their own behaviour rather than us imposing something artificial punishment. So in planning consequences, here are a few practical tips. The behaviour you're trying to target should be verifiable. So whether or not someone's used drugs may be hard to verify unless you have urine drug testing. That is available at some cost, but that could be used. But something like attendance at a group can be verified. When you respond, you should respond as soon as possible after the behaviour, which brings the most reinforcement or discouragement, depending on what you're using. Your consequence, you should be able to live with it. For example, if you're not prepared to lend your loved one money in the back week after they've spent it all on drugs the former week, then you may be living with someone who's, in addition to withdrawing from drugs, has nicotine withdrawal. It may be an option to offer to lend them some money, providing that they agree to a payday management plan, that is, give you their key card until it's paid, and then you go shopping with them. It also should be an easily reversible consequence. For example, permanent eviction from your house is not easily reversible, and that should be reserved for a time when it's inevitable, but a temporary suspension may be better. So rewards are the most important consequences you can employ. Removing penalties such as removing debt through a work development order. This is often associated with attending groups and can be a strong reinforcer for group attendance. In terms of reducing behaviours, removal of privileges. Privileges could be such as borrowing some of your things, your money, your transport, and even your presence. Your presence is a privilege, and if the person is behaving badly, then you may tell them that you are going to withdraw to another place because you don't enjoy their behaviour while they're, for example, intoxicated. Natural consequences are best in terms of punishment. For example, the outcome of police charges or fines. Punishments are not necessarily the first, shouldn't be used as a first line in terms of consequences and behaviour management. Sometimes when there's been a long history of negative interactions, it's hard to think of positive ways of interacting with your loved ones. So this is a list of some areas that you might think about in terms of using as reinforcers. So when you see something emerging which is appropriate or help-seeking behaviour, then reward it straight away. It's very important. Instead of catching them doing something wrong, catch them doing something right and reward it. It's a powerful effect. It doesn't mean you're going soft on boundaries. It just means that you're really reinforcing behaviour that is eventually going to overcome those negative behaviours. So spending time together, giving your attention. This could be sharing activities together or conversations together. Acts of service towards your loved ones, such as meeting day-to-day needs, their washing or something like that. Creating pleasant experiences for them, so making a nice meal for them. Direct communication of your love through expressing your feelings, your words, physical touch, or gifts, objects, activities, or financial. All these things can be used as positive reinforcers. So looking here at our model of behaviour management, the area of activators and behaviours and beliefs, is there anything we can do as family and friends to help our loved one in this area? These are areas that is all about the loved one acquiring new skills to manage activators and substituting new beliefs. For example, if a person has an anxiety episode, then rather than, say, reaching for a substance, they may practice a relaxation exercise. Or in relation to a belief or a thought that crops up, such as when faced with an urge, they may think, oh, I can't cope with urges. Instead, they may say to themselves, I know this urge will pass. I'm going to distract myself until it passes. In the area of activating events, such as external triggers, skills such as learning to escape from a trigger or to distract oneself from a trigger, and in preparing for unavoidable triggers such as payday as a trigger, one may prepare for that, for example, by giving one's card to someone overnight and then going shopping with them the next day. and internal triggers which relate to often our mental health or skills. This is where attending a counsellor, attending to mental health issues, and doing skill courses may benefit the person. So what we can do as family and friends is certainly reinforce attendance at therapy sessions, whether they're counselling one-on-one or group therapy or intensive rehab activities. We'd also help the person with unavoidable triggers if they're in a position where they're seeking help for their substance use from us. They may ask us to help them arrange to help them manage their payday. Also helping them to maintain their mental health and their levels of hope. It's important that they have a sense of hope, and it's often dependent on you keeping your sense of hope, and which rubs off on them. It's important to affirm them and tell them that you believe that they can do this and that they can get through their substance use problems. And often to do this, you need to remember your own self-care and stay strong. So getting back to our self-care issues. Once your loved one has reached the stage of preparation or determination that they wish to get into treatment for their substance use, it's important to be able to help them through those steps if they request that. And so having a few ideas of entry points, certainly your GP is a good entry point. The local district health service will have an intake line. This is the Hunter New England intake line. Certainly self-help groups can be a first port of call, as are psychologists and counsellors, and some non-government agencies that provide particular focus of service, for example, post-prison release or housing agencies. These agencies may be able to be as a port of call to help you get into the system. So let's look at the treatment setting for people for substance use disorders. It's important to understand that there are psychosocial treatments, which are talking in behavioural treatments, and there are medical treatments, which I'll look at in the next slide. In general, psychosocial treatments all have a similar outcome, but there are different settings which they can be provided in, and it's important to match the person to the setting. So the least intensive setting might be an office-based counsellor, and this would be for somebody who will be able to keep an appointment. The next setting where someone may not be able to keep an appointment, but would be better just to turn up at a regular group meeting. This would be something like AA or SMART or NA. Mutual help group meetings are also good for family and friends. Community-based intensive programs are few and far between, but they can be provided by private hospital treatment units. There's also a public program called the Matrix program in South Australia and Victoria. And here in Newcastle, we have a post-release program called Samaritans Recovery Point. This is like a residential rehab, but it is people live at their own home. But it is a useful program for people post-rehabilitation, post-residential rehabilitation, or leading up to that. Residential rehabilitation is for people who are more chaotic, who have not made any progress with less intensive treatment programs, who may be at high risk from the level of substance use that they're engaged in, and who may have a level of antisocial behaviour that needs managing. Involuntary treatment is not commonly used, and it's really only legally indicated for people who are at risk of death or who have a mental incompetency. By de facto, it is used in people going to jail, where there's a high level of forensic behaviour also. So apart from psychosocial treatment, there is medical treatment, and some drugs require specific medical treatment, such as opioids. In the case of opioid addiction, the risk of relapse is so high and the consequences of relapse is so grave that detox is not indicated. Maintenance treatment with long-acting opioids, such as methadone and buprenorphine, that have been shown to be the safest and most effective treatments. Alcohol may require a detox, which, depending on the level of intake, Certainly can be quite dangerous to detox somebody if they have a heavy constant intake due to risk of seizures or delirium tremens. A GP can help you decide where and how a detox can be carried out. There are also 3 good medications that have been proven to be helpful with alcohol relapse prevention. Sedatives or benzodiazepines or Valium type drugs cannot be stopped suddenly. They again can lead to seizures and a withdrawal syndrome, not unlike alcohol, but some days delayed. They can be managed through a controlled supply of the medication or a gradual reduction. Cannabis and methamphetamine do not have much of a physical withdrawal, but they often are accompanied by mental health problems and therefore often require treatment for psychosis or depression or anxiety in their own right. So this is the end of this program, and it's been a long session. Thank you for your attention. Remember that there are many services out there available to support you, and this is a list of them. It is not enough just to have some information and try to go it alone. You really do need support in this process. So do reach out for those support groups that are out there. It may need to be arranged on an ad hoc basis. For example, at Samaritans Recovery Point, this is support is arranged as people request it. I'd like to acknowledge the Port Stephens Community Drug Action Team for sponsoring this program, and also Professor Robert Meyers for his work with community reinforcement approach family training. Thank you very much, and feel free to contact the Community Drug Action Team at Port Stephens for further information.